All right, good afternoon, all. Thank you for being with us today. We're talking about a very important topic today, which is health care, which is obviously a vital human service. It's also a very important economic engine for this state. And to get us started and to acknowledge who's here today, I'm going to turn it over to Dr. Zucker, our phenomenal health commissioner.
Thank you, Governor. Thank you very much. And thank you all for being here today on a very important issue. I'd like to recognize the hospital executives and CEOs who are here today. Lorraine Brown from Interfaith, President and CEO of Interfaith Hospital. Bruce Flans, the President and CEO of Catholic Health Services of Long Island. Robert Friedberg, the President and CEO of HealthQuest Vassar Brothers Medical Center. Alan Gertschy, President and CEO of Catholic Health Services of Long Island. Daniel Messina, the President and CEO of Richmond University Medical Center. Victor Politi, President and CEO of Nassau University Medical Center. Tom Quattrochi, President and CEO of Erie County Medical Center. Dr. David Rich, President and CEO of Mount Sinai Hospital. Wayne Riley, President and CEO of SUNY Downstate. And Dr. Steve Safford, President and CEO of Montefiore Medical Center. Thank you.
I want to thank everyone for coming together. We just had a briefing on some of the relevant healthcare issues that are going on in Washington now that would have a dramatic effect on this state and a very damaging effect on the state. I'll go through a couple of numbers with you and give you a quick presentation on what we're looking at, and then we'll take it from there. We are 11 days away from what would really be a disastrous cut in Medicaid. On October 1st, unless something else is done, a multi-billion-dollar cut will go into effect, which will impact the neediest New Yorkers and the hospitals that serve the neediest New Yorkers. The cut will be critical federal funding that reimburses hospitals through the Medicaid program for what we call uncompensated health care costs. It's also known as the Disproportionate Share Hospital Payment, or DSH. Federal government always has nice names that just roll off your tongue. So the DSH payments. Of the cuts that would go into effect, New York would receive 16% of the cuts, $2.6 billion, which is a disproportionate cut to the amount of the program that New York actually represents. To compare it to other states, New York would get cut $2.6 billion, California $1.2 billion, New Jersey $1.2 billion, Texas $1 billion. So you see the magnitude of the cut and the disproportionate nature of the cut. Over the next 18 months, $1.1 billion would come out of the state Medicaid system. That is 1/3 of the entire DSH program. And again, the DSH program is the funds that go to serve the hospitals that are serving the uninsured and the poorest New Yorkers. $2.6 billion when fully phased in. It is not too strong to say that this would decimate the public and safety net hospitals in the state of New York. The cuts would affect about 3 million New Yorkers who get served at those hospitals. Eventually, it would affect about 219 hospitals, but the initial impact and the most significant impact would be on the public hospitals and the safety net hospitals. The public and the safety net hospitals are the hospitals in this state that serve the uninsured or people who don't have enough insurance. Public hospitals are run by the state, SUNY Downstate, SUNY Upstate, by the state through OMH facilities, OMH-operated facilities. Also, there are counties that run public hospitals, Nassau County, and here in New York City, HHC, Erie County, and Buffalo. Safety net hospitals are not public hospitals, but they're hospitals that, again, treat the same population. One Brooklyn Health, which is the amalgamation that we're putting together in Brooklyn right now, Wyckoff, St. John, St. Luke's, they would bear the initial lion's share of the burden. Federal government's answer is always the same: well, let the state pay. The state already pays $1 billion in direct operating support to hospitals. And when you look at the size of this cut, 1.1 over the next 18 months, $2.6 billion, there is no way the state can pick up this cost. The state is already facing a $4 billion deficit going into next year. $4 billion deficit. There is no way we can close a $4 billion deficit and absorb an additional $1 billion and then $2.6 billion cut. It is mathematically impossible. Now, importantly, this is not an impending congressional action. This is current law. Congress would have to stop this affirmatively. If they do nothing, if they don't reach agreement, if they gridlock, this goes into effect in 11 days. And that's why this is frightening. Second, and compounding this situation, is the Graham-Cassidy repeal of Obamacare. Now, in some ways, we were in the eye of the storm. There was a storm earlier on in the congressional session when they were going to repeal Obamacare. And they failed, as everyone knows, and then it got quiet. We thought the storm was over. The storm wasn't over. Turns out we were in the eye of the storm, and now the back end of the storm is hitting us with a fury that we did not anticipate. Depending on who you talk to, the passage of Graham-Cassidy is a very real possibility. It would be devastating to the state. What we talked about earlier, those were the dish cuts. Again, Congress has to act so that doesn't happen. That's devastating. But the repeal of Obamacare would be even worse. It would repeal the Affordable Care Act, and then it would block grant Medicaid funds calculated on a per capita spending basis. That would mean a cut to the state of about $19 billion. Now, the federal government likes to say rhetorically and glibly, we're going to block grant the funds and give it to the state, and then the states will have the flexibility to run the program, and the states know best, and if we give the money to the states, that's the best thing we can do. The federal bureaucrats shouldn't make determinations, give it to the states. Newt Gingrich used to talk about this during the Clinton years, and we called it passing the buck without passing the bucks. You know, it's a great position to take. Federal government says, we gave it all to the states, and now it's up to the governors, and the governors have flexibility. Caveat, we gave them less money than they were getting. I would not trade $19 billion for the flexibility, because if they cut us $19 billion, if I was as flexible as a Gumby doll, we could not fund our healthcare system. Again, it's just mathematically an impossibility. It also puts 2.7 million New Yorkers at risk of losing their health insurance. They are designed, these cuts, to hurt states that have expanded Medicaid. And we have expanded Medicaid. We believe in providing health care. We believe in this state that health care is a human right. Our health care system is something we're very proud of. And Medicaid was a long-standing federal program that was designed to do just that. This is now all retroactive philosophy. Now the federal government's position is, well, we don't really support the Medicaid program or growth in the Medicaid program. But that's why it was created. And we used it just as it was intended to be used. To penalize us for doing a better job than other states is a gross unfairness. And that's how I see it. We did a better job of building a healthcare system and providing healthcare. Medicaid was the main federal tool, and we used it. And we used it well. To now say, well, the federal government wants to get out of the business, and therefore they're going to hurt the states that did exactly what the program called for them to do, is the height of irrationality. It puts 1.2 million jobs at risk here in the state of New York. Again, their ideology is at work. It would defund Planned Parenthood. And the new Graham-Cassidy bill would take away a lot of the protections that were in the Affordable Care Act. It would allow seniors to be charged more for coverage. It would allow states to opt out of the law's essential health benefits. It would eliminate the employer and individual mandate and allow companies to sell what we call bare-bone plans. It would also, I believe, be devastating to the economy. You know, our healthcare system is an important economic engine. It's also an essential component in our overall financial system. And we have billions of dollars in bonds that have been issued by the state, by individual entities for capital projects, et cetera. You now cut that funding stream. That funding stream was the underlying security for all that financing. And that would have a dramatic effect on the markets. This is a last-minute attack, and it must be stopped. Between the repeal of Obamacare and the DSH cuts, this is a devastating 1-2 punch to the state of New York. They compound each other, actually, because the DSH cuts are something we couldn't absorb. On top of the DSH cuts, if they were to repeal Obamacare, it would be a crisis, a true crisis in the state of New York, and I mean that word literally. The good news is we have a very powerful congressional delegation. Senator Schumer has said he's going to do everything he can to stop the Graham-Cassidy bill, and I applaud him for that. We also need them to act affirmatively to stop the DSH payments, and 11 days is a very short period of time in Washington. So that's why today we want to communicate the sense of urgency and the unfairness that this represents to the state of New York. I believe it's unfair to the healthcare system all across the country. It hurts the most vulnerable, but it disproportionately hurts New York. And that's just unfair. We are going to speak with one voice as a united healthcare system, speaking to our congressional delegation, speaking to members all across the nation, and doing everything we can to stop these cuts, which are all retroactive. They do no good. The only question is how much pain they would inflict. My own personal opinion has been that they've always been looking to repeal Obamacare for two reasons. Number one, it's their political gospel. They ran for office saying they were going to repeal Obamacare. Number two, they need to find revenues to finance their tax cuts. And the place they always looked to find the revenues to do tax cuts for the richest was from the healthcare system. And that's exactly what this is. With that, let me turn it over to Ken Rasky from the Greater New York Hospital Association for his comments. We'll then hear several other comments, and then we'll be open for questions.
Well, thank you very much, Governor. You have put together a coalition of interest of executives, of hospitals, physicians, our colleagues from the labor movement. And we have to speak, as you put it, with one voice. And we appreciate your spirited leadership on that score. The destruction of the healthcare system is at hand. It's 11 days away. It's like a ticking time bomb. And that is an extraordinary statement. Now, the dish cuts, as the governor pointed out, are one the first punch and is a huge hit on the New York healthcare system. $1.1 billion, and it will hit immediately. It impacts immediately. This is not some delay here. It happens instantaneously. And then following that and it's not even doubling down, sir. It's a quantum increase on the pain of where the Graham-Cassidy would take that number and explode it to $18+ billion, for round numbers, $19 billion. And ladies and gentlemen, if you think that doesn't dismantle the healthcare system, well then guess again, because it does. It tears apart the fabric that we're dealing with. Sure, it hurts the institutions. I'm looking at Lorraine and Bruce, the safety net institutions, our colleagues in the public sector who are well represented in this audience as well. But sir, it's not only those patients, the poor and those that are struggling, it's everybody. If these cuts go through, there is no New Yorker, rich or poor, that will not be touched by it. And that turns out to be absolute fact, because even in an academic medical center that has a lot of commercial business and may have a bottom line that's healthier than most, the fact of the matter is even the best of the best can't withstand these kinds of cuts without trimming staff, without cutting services, without rearranging themselves substantially to the detriment of everyone. And that is the hard facts. And that is something we do not want to see. So, Governor, we're grateful for your leadership. You know, you have been there time and time again. And now we're on the countdown of 11 days. We need our congressional delegation, our leaders in Washington, Senator Schumer, to lead the Senate activity to stop these cuts from happening, to make sure the dish cuts don't occur, and God forbid that Graham-Cassidy does not go into law. And with that, sir, I want to turn it over to my good friend and colleague, B. Grouse from the Healthcare Association of New York State.
Thank you, Ken. And thank you to everyone who took the time to be here today to present a united front. And I'll join in thanking you, Governor Cuomo. We've been here fighting before, and we're here today. And we're going to continue and get through September 30th. I'm a hockey mom, so I feel like we're running the clock a little bit. And we have to work with Senator Schumer and our entire congressional delegation to voice our opposition, not just to the Medicaid dish cuts, but certainly to Graham-Cassidy. And as was said before, that this bill will absolutely undermine our healthcare system and make it very, very difficult for us to continue to move forward on healthcare reform efforts. So I hope that, certainly healthcare is complicated. All of these policy issues are complicated, but we stand together on one thing, and that is the importance of having access to healthcare for all New Yorkers. So I hope that we'll continue to do our grassroots. I know we're working at the national level and at the state level to work with our states that have Republican senators and to, in a very quick turnaround time, to push this back and hold on the Senate. And if we have to, we'll work the House. So with that, we'll do everything we can. And with that, I'd like to introduce Maria Castañeda.
Thank you. I'm very happy to be here to stand with Governor Cuomo, with our healthcare leaders in defending healthcare. Today, once again, our healthcare is under attack at the federal level. This is not the first time Congress has tried to pass regressive health care legislation, but we cannot be complacent. This reckless partisan bill must not pass. The cuts being contemplated by the Graham-Cassidy proposal truly are very scary for those who need care and those that provide care. It is hard to believe that Congress will actually consider a plan that's worse than the previous proposal. $19 billion in cuts that will roll back our progress in New York State. It will jeopardize providers that provide the care for the most vulnerable, the seniors, and the people with disabilities are at risk. But if it's not that bad enough, it's projected to cut thousands of healthcare jobs and all the local economies in the communities that rely on those workers that create jobs. Our 1199 members, Governor, and the healthcare are ready to stand together. We want to tell Congress loud and clear that stop playing politics with our lives. We need to improve and invest in our healthcare system, not slash it. That includes stopping the destructive DSH cuts coming October 1st. We are ready to stand with the governor, with all our healthcare leaders. I know we are gearing up for a big lobby day and all our phone bankers to do whatever we need to do to win again healthcare funding for our patients and communities. Thank you. And now I'd like to introduce my other partner in the trade union, Jill Furillo.
Thank you, Maria. First of all, I'd like to thank you, Governor Cuomo, for really stepping up for New York's health care. All of us are speaking with one voice, and I'm proud to stand here with you and with all of our partners in this effort. The governor has long been an ally for our workers, and he really does understand how devastating these policies would be for nurses and our patients, and frankly for all New Yorkers, because it goes beyond health care. Earlier, we have successfully joined the fight against all previous repeal efforts, but unfortunately, that fight is not over. Today, we once again join with Governor Cuomo and again with all of our allies to oppose these new and very dangerous and regressive policies. We must make no mistake that this new bill, Graham-Cassidy, is worse than any of the others before. This bill would water down healthcare standards, restrict access to quality care, and threaten the financial viability of the entire healthcare system in this state and the thousands of nursing jobs, our members, who depend upon it. We believe, as Governor Cuomo stated, that healthcare is a right for all, and nurses and direct care workers should be able to provide quality, decent care to everyone who needs it. And I want to emphasize everyone. This bill will take us back to a time when healthcare was more expensive, when barriers to access was much steeper, and it would actually make patients come into our hospitals sicker and sicker, and you know what that means. They will go and seek care in the emergency rooms, and we don't want to go back to that era. We are proud to stand here with our governor to condemn this legislation in the strongest of terms and call on Congress to do everything that they can do to protect the nurses' ability to be able to deliver quality care to all of our patients. Thank you.
Thank you. Very well said, Jill, Maria, and Bea.